Hello again, I'm Nicholas Markey, physical therapist by day here at Beach Barbell Physical Therapy in Wilmington and online fitness coach by night at Beach Barbell Training. Today I wanted to talk a little bit about shoulder pain and shoulder rehab. Typically you'll hear the words often used as like impingement. Generally what the person's symptoms will be they raise their arm up and they start to feel pain, somewhere usually around in this zone here. And oftentimes what they're told is that, the potentially part of the rotator cuff and or tendon are being maybe impinged by the bone. It's really not clear if this is actually what's causing those symptoms. When someone doesn't have shoulder pain, when they're moving their arm here, there's technically probably some quote-unquote impingement, just because there's less space in this zone here, and so just the tendon muscle, that's just what they have to deal with normally. So whether that's actually what's causing someone's pain, it's not clear. There's also the other fact that we always talk about, using words that may incite fear and or potentially someone not using the area may potentially be a bad thing as well. So if you say something like impingement, it sounds somewhat scary. Someone might kind of freak out and then maybe they don't ever try to use their arm a whole lot, which maybe there can be ways to find them to be able to use the arm in a more tolerable fashion. So typically a lot of cases with shoulder pain, usually it's with someone talking about when they lift their arm up, maybe when they reach behind their back, maybe it's they can't even get behind their back because of the pain, maybe when they try to put their arm back into like a jacket or something. It's very possible that there is some sort of rotator cuff or tendon sort of sensitivity or something, something got tweaked or irritated in that area. I would say it would make more sense to me if someone's lifting their arm up and they're having a lot of pain out here and it's potential that it is the rotator cuff that's irritated, then I think it has more to do with just the amount of torque that the rotator cuff has to produce out here to hold the arm up. This is kind of the peak torque range for that rotator cuff, meaning that that's where it has to work the hardest. So if something's sensitive and you're making it work the hardest out here, it could kind of make some sense that might be where this person feels pain here. And then, with reaching behind the back, it's probably putting that area on more of a stretch, because if the posterior cuff, which helps lift the arm up here, that's what usually like the supraspinatus, infraspinatus, and teres minor, their main job is to help lift the arm up with the deltoids and the upper trap. Okay, so they also rotate the arm, and their main job is to actively externally rotate, which would be roll the arm back this way. So when I roll the arm this way, internally rotate and kind of put it back this way, I am probably putting those areas on quite a bit of stretch. And if they're very sensitive, they probably don't want to be stretched out too much, right? And then reaching back and try to put a maybe like a coat, my jacket on or something. You're putting them in their zone of where they're like, not only are they like probably helping lift the arm here, just the actual arm, but then having to actively externally rotate against gravity. So again, you're just making them work harder in this zone probably. So, and those are usually going to be the prime symptoms when someone's complaining of shoulder pain. I mean, yes, there are other cases, but I'd say majority of the cases have to do probably with what you might say just rotator cuff related pain. And it's just simple enough to call it that, or call it some sort of just call it shoulder pain. Because in reality, when someone comes in to see me, we check all the angles. We check all the angles, see which ones are irritated, check, when we test maybe a little muscle strength, not necessarily for like how strong it is usually, but maybe just to see, does this irritate it? And then that gives us maybe a better picture of where we could start. Because yeah, you can kind of, you'll develop sort of what we would call like a differential diagnosis. So if somebody's, having pain when they lift up their arm here, and then maybe also when you try to have them resist here, that really hurts and it's kind of weak. You can say, okay, I mean, it seems reasonable that potentially the rotator cuff is irritated, so that might be on the top of your list. Now, that doesn't really change exactly what you may do per se, because we're going to more go after the impairments anyways. So you're just going to check what are all the angles that are not doing well. And just like my kind of 3 bucket system, angles that are green that don't feel bad at all, you go ahead and just rock those. Yellow is probably where you're going to do a lot of your work. Those are ones that kind of feel a little off, but not too bad, and you're still under control. Maybe they feel a little weak, maybe a little bit of pain, but tolerable. And then the red are the ones that are really painful. So those are probably ones you're not going to go and work on right away anyways, because you might just keep making that area more pissed off and sensitive. So typically what I'll start with is, so say that, the person goes up out to the side and that's where it's really painful. And then maybe they go up front and they're like, yeah, it's just a little bit of pain, but not too bad. I'm probably not going to start with having them work with like lateral raises here, just because that's probably a red exercise. But what I'll probably have them start doing is maybe some front raises. Or is there some sort of overhead press variation, maybe like where they hold dumbbells in here in like a neutral grip and go up. And then they're kind of more in like a flexion, this front lift type zone. And just test them out and see which ones work. Come up with maybe 1, 2, or 3 exercises that work out for that person. Typically I'll try to find some sort of arm lift. So an arm lift could be lateral raise, front raise, what we call scaption, where it's more of kind of like a diagonal, some sort of overhead press. I'll try to find one of those that works out and then start loading that. I like those because they're not only going to work the deltoid, the shoulder muscle, but they're also going to work that posterior cuff, which is usually the one that gets irritated with shoulder pain. When someone's complaining of shoulder pain, or at least we suspect it's the one that's irritated. And then I'll try to find some sort of rotation variant that will work well for them. Again, there's lots of different ones: laying on your side, moving it in and out, laying on your back, moving it up and down like so, sitting and having it rest on your elbow and kind of move, or your knee, and kind of going up and down like this. So lots of different ones to play with and test out. And again, try to find the one for that person that is probably in that yellow zone where they're like feeling like, okay, I can feel this effort here. It potentially maybe even just a little bit of pain, but it's tolerable and I'm, in control and have decent range of motion with it. And that's my other thing, is that I want to also keep them trying to, if possible, moving through full range of motion if possible. I want to load that shoulder in the biggest range of motion that they can handle. So I focused on kind of the common ones would be typically when someone complains of shoulder pain, it's usually when they are, and it's related to potentially the neuromuscular system, right? The muscles and bones and nerves and whatnot. Typically, they're gonna have issues with lifting their arm, which could be oftentimes, or possibly the posterior cuff, which helps lift the arm and whatnot. And so then what we'll do, again, to recap, is check all the angles anyways, and then try to load the angles that are having trouble but are tolerable. Now, if say that none of the elevation ones feel okay at all, like maybe front hurts like heck, side hurts like heck, it just all really hurts, and maybe all can be classified as red, then what we might do is we might actually start in the reverse and just do some sort of pull down. And the pull downs are cool because it actually will lift their arms up, which will usually feel fine. And again, I'll test that with them. I'll lift their arm up with them. And then if they're like, yeah, that's actually better, then we'll say, okay, maybe it's starting with a pull down. So we're getting into the range of motion, maybe not actively, kind of passively, the arms are being lifted up, and then I pull it down in whatever, fashion we want to try. And and start with that. Maybe we don't find an overhead move, and then that might be where we might go to like an incline press, where they're laying back here, so they're going to work their shoulder a little bit but not so directly above, and that might be more tolerable. And then if the incline press isn't tolerable, then maybe move it down to just more of like a flat bench press. So another way to load the shoulder, but perhaps a way that's more tolerable than the arm elevation kind of work. So lots of different fun options, always trying to find a way forward, or you could say find an entry point of sorts to try to get the load in the body so that the body can start changing towards, better movement, better feeling movement, hopefully. And the person can also improve in their confidence in using that part as well. And then of course, kind of just like with any part, we're going to see how we're doing over, each session, each week, each month, whatever, and just try to progress it just little by little, so if we find an angle that works with the arm elevation, then we're going to progress that as much as they can handle. And then every so often maybe check some of those other angles just to see how they're doing and see if maybe we can start incorporating them as well. If they're ready, then we'll throw them in. If they're not, then we will not worry about them yet and just keep moving forward, and just like I've talked about before, I like my reassessment each session is pretty straightforward. It's just, how are you doing? how did you do after the previous session? Like, how was it, the next day or two? If things were decent, then we'll progress it a little bit. We'll load it up a little bit more. Maybe add something. We'll see, depending on what we're trying to do. So relatively straightforward. Doesn't mean it's easy, and it can take time. A lot of people want to get this thing done in a couple of weeks, but it could take months really before they start getting noticeable changes. And that's why it may be a good idea to hold off on some sort of surgery with it. I mean, unless there's signs of full tear where their arm just falls, like there's no strength at all when they lift it, and they fell on it or had a traumatic, kind of event, they fell on it or something, then you might, start leaning far more towards surgery. But if it's kind of atraumatic, like a lot of cases are, you just kind of woke up one day and you're just like, oh, my shoulder really hurts or something. Those cases are probably going to be done best to at least start with physical therapy. Because if best case scenario, a few months and the person's back to feeling pretty good, decently with their arm and using it and rocking on. And I guess worst case scenario is they end up having to have surgery, but the arm and the person is going to be far more prepared for it because they at least trained it up as much as they could possibly handle before surgery. So their body's going to be far more ready to undertake such a surgery. So anyways, thanks for listening or watching. Again, I'm Nicholas Markey here, physical therapist and online fitness coach. Reach out if you need any help and let me know what you think. And I'll see you next time. Peace.